Okay, this is part 2. So we left off here, and now I'm going to talk about the conversion between the sources. So all 6 sources agree that caregiving for Alzheimer's patients leads to major emotional, physical, and biological stress. The Alzheimer's Association highlights emotional strain, burnout, and the need for self-care and support, along with putting yourself first. The Fisher Center reports that many caregivers face long-term depression that worsens over time. Bayer adds a biological perspective showing immune changes and elevated cortisol via chronic stress, so more of the research-based. Caregivers act as hidden patients, facing depression, fatigue, and health decline due to constant emotional and physical demand. Clinical and advocacy organizations stress awareness and coping strategy for the public as a whole. The main agreement being how caregiver stress has a measurable health effect, primarily due to prolonged stress exposure. However, they explore different levels of the impact, such as sociological, depression, burnout, role conflict, physical, such as fatigue, illness, sleep loss, puffy bags under your eyes, biological, immune suppression, and elevated cortisol, social, isolation, loss of social support networks. And also these articles illustrate that caregiver stress is well documented, but the exact neurological pathway linking emotional stress to physical decline definitely needs further research conducted. So the gap research question: while studies document the emotional and biological costs of caregiving, little research connects brain changes with the long-term health decline. Most focus on stress or depression alone, not the underlying neurological pathways. We know that depression, exhaustion, and immune dysfunction occur, but we don't understand how the brain changes in response to chronic caregiving stress or how these neurological changes might predict later health decline. So, my question to you is, how does prolonged caregiving for Alzheimer's patients alter the caregiver's brain and stress response system, and how might these changes contribute to the long-term emotional and physical decline? Understanding the neurological and sociological toll of caregiving could guide early interventions, helping to identify at-risk caregivers before serious health decline occurs, especially over long term. This knowledge can inform healthcare policy, mental health screening, and support programs aimed at protecting both the caregiver and patient well-being, something I believe so strongly in being incorporated in the healthcare system, not only for caregivers, but also nurse, doctors, etc. It is definitely hard to put oneself first, but prioritizing caregiver health is key to improving outcomes for both caregivers and the loved ones who depend on them. Thank you.